So AJ, over to you. I mean, it seems like there's been some real regulatory progress with, the CAA and the Inflation Reduction Act. How does this impact Capital RX and the market opportunity for the business?
Yeah, so starting first with Consolidated Appropriations Act, it's kind of like this funny little bill that, provided subsidy and relief in a variety of different areas in the country, but hidden in it on like page 500 something is this kind of disclosure for any self-insured payer around benefit compensation and benefit costs. And a lot of people don't understand that much of the self-insured industry is somewhat unregulated or underregulated,
Right.
where it kind of falls under the Department of Labor, which is kind of a result of ERISA being written in 1974, where kind of it was authored by the Department of Labor. And so what was happening is that the country has obviously continued to expand and have runaway costs in healthcare. But no one had really started to think about all the different ways people are making money on healthcare. And there's never really been a disclosure set on this. I think if you look back historically, the Department of Labor did a very good job, because also what's contemplated under ERISA is pension and retirement funds. And those disclosures were really put in place in the start of the 21st century, which forced people in the investment advising and asset management business for retirement plans and pensions to start to disclose how they're making money. Because, not to oversimplify, there was a question: if someone's charging a loaded fee of 7% and the fund is only performing 3%, there's really not much value being delivered to that sponsor of that plan. And so the Department of Labor really didn't have the bandwidth, I think, not to speak for them, to tackle the healthcare side of the equation on compensation coming out of healthcare. And when you have a $4 trillion business, a lot of people are being compensated, rightly so, for their services, perhaps some people being overcompensated. And here's the scary part: a lot of people are not disclosing the full compensation. And so what the Consolidated Appropriations Act did is that I think it amended Section 408B2B of ERISA.
Who's tracking?
And it basically said, hey, each year, you, the fiduciary, the payer or sponsor of a self-insured plan, must ask everyone who's involved in your healthcare benefits what certain costs are. So there's a reporting structure, but more importantly, anyone who's making compensation, what are they making on these product offerings? And so this is the first year. And I think one of the things that's great about Capital RX is we want it to be future-proof from the start. Is we don't make money on drug spend. We charge a flat administrative fee. So all of our value passes through to the end payer. But more importantly, when it comes time to report, we have an admin fee and ancillaries on clinical services that are all in the contract. So part of it is you not just have to state what your fees are, it has to be included in your contract, and you have to help report for this each year. And so this, I think, is going to slowly become a bigger and bigger thing. And I think we're very well positioned, because I don't want to say we saw the future, but I just couldn't believe the country could continue to operate the way it is when you have runaway healthcare costs, and we have the limited oversight on who's making money on healthcare services. And so I think we're very excited about that. The other one, the IRA, the Inflation Reduction Act, this is kind of looking long-term, starting in a variety of different areas in which the federal government can, being the largest payer in the country, rightly so, are there ways in which perhaps the federal government should get more? Or even more for less is a good way to look at it. And so, starting with the negotiation on Medicare, on, rebates on particular drugs. And, it starts with a fairly narrow list and it builds up to 80 or 90 drugs going into, I think, 2030. But I think the broad paint strokes of this is, for the first time, the government is really starting to lean in and ask for the value it should be, not just for the government that sponsors a large part of this cost, but more importantly for the patients being served under these programs. And so I think it's an amazing first step. I think, again, is it showing progress as an entire country, looking in the right direction. I know there'll be some friction points and there'll be some learning along the way, but again, it's signaling to myself that from a legislative and regulatory side, the government cares and is looking at improving all of these programs.
It is kind of amazing that this is just happening for the first time, but at least we're here. At least we're moving in the right direction.
Yes.
Progress.